Some of y'all seniors are in trouble
Huh?
when it comes to your health care plan.
What?
And not only seniors, you people with chronic diseases, you in trouble too.
Ooh.
Oh, y'all, it ain't pretty.
Mm.
Hello, everyone. Thank you for stopping by to see me today. Do I have some stuff to tell you and show you? And you're going to ask yourself, is it true though? How can they do that? What for? Who? Who started this and why? Y'all, if you are a senior on Senior Advantage, you in trouble. Not only seniors, y'all. People who rely on the diabetic supplies, people who rely on the monitoring, like me. See that right there? See it? Yep. I can look on my phone and see what my sugar is, y'all. No more with UnitedHealthcare. No more. Right now, I am at 85. I gotta eat before it gets below 70. So I gotta hurry up and make this video. All right. And not only that, if you have one of those blood pressure machines like I do, they can monitor you with that. That means that they can see you. They can go into the app and see what your blood pressure is and what your blood sugar is on those monitors. But that ain't the only thing, y'all. There's also going to be millions of seniors, millions, and I don't know why, cut off of health care, their plan. I don't know if they cut off health care or it's just the plan that they're on. I have no idea, but we're going to see in a minute. And of course, everybody wants to blame Trump. But there's going to be this one video that I play where the lady is going to show you, okay, who fault it really is. You can believe it or not. I really don't give a damn, all right? I'm not saying Trump is perfect because he's not. No man is, okay? I don't like some stuff he did. I don't like what Obama did. And I definitely don't like what Biden did. I really don't, okay? But you got to go by the policies and what's best for you and your family. Moving right along. I want to thank you for the PayPal, the Cash App to buy me a coffee. Thank you so very much because I love the heck out of some coffee. And I want to thank the people who watched the entire video. You guys are awesome. You really are. I know some of you people cannot afford to buy my products. I know you can. But you're helping me though when you watch the entire video because it pushes my video out there to others. And when you share and hit that like button. So do that for me, all right? You ain't got to buy nothing, but the ones who buy something from me, I thank you so very much. Look at this one. Squeeze the day. Squeeze the day. Like I said, my mugs are printed on both sides, y'all. Both sides. All right? Squeeze the day. Some of y'all gonna have to squeeze the day because, oh Lord, after this, what I show you today, you're gonna be, oh Lord, some of y'all probably gonna be worried. Don't be worried. Jesus got your back. Somebody's gonna help you back, okay? Move right along. Here we go with the first video. UnitedHealthcare is cutting monitoring.
Multiple outlets have confirmed that UnitedHealthcare is cutting remote patient monitoring for diabetes and hypertension starting on January 1st. So I need you to understand what this means in real life. Remote monitoring is the service where your blood pressure cuff, glucose monitor, or weight scale sends data directly to your care team. It's one of the reasons your provider can catch a problem early, adjust your medication without an office visit, or prevent a hospitalization.
So why do you think they're doing that though? Is it costing them a lot of money? Is it costing a lot of money for the insurance companies? You think UnitedHealthcare is going to be the only one who do this? You do? There's something wrong with you. It's not going to be just them. It's starting here with them. I don't know. A couple people said they're probably doing it now with their insurance. I think they're having problems. I have no idea. But y'all let me know if you're having problems down in the comment section. But it's not going to just stop with UnitedHealthcare. They're going to see how it's working for them. They're going to see. But see, what I don't understand, maybe y'all tell me the same thing. Insurance companies make all this money. Do you know how many people don't ever use their insurance? You trying to tell me it's more sick people using the insurance every day, the high cost of it is overtaking the people who don't use the insurance plan. They just got it because they need it just in case. Put it on down there and let me know. Because I'm telling you, something's fishy about this. It really is.
So CMS, the federal agency that runs Medicare, has supported this since 2019 because it literally saves lives and reduces cost. UnitedHealthcare is now saying they will only cover remote monitoring if you have heart failure.
Damn near dead, basically. Damn near dead. I don't understand. They can prevent you from having problems, these machines, these monitoring systems. Why wouldn't you want that for your patients, for the people who pay you money to insure them? Why wouldn't you want that? Because if people don't monitor themselves, what's going to happen. They're going to be eating things and doing things that they're not supposed to be doing. Their health is going to get worse because it's not being monitored. Because some people don't like sticking their finger. They don't like it every day. Don't get me wrong. I'll do it. I will do it. If they stop the monitoring thing, hey, I'll just go back to sticking myself. Okay? I'm not lazy like that. I'll do it. Okay? I have my own blood pressure machine. They ain't got to monitor it. They ain't got to do that. Okay? I got 2 blood pressure machines. The one that they monitor and the one that they don't. So y'all just going to have to stop being lazy and monitor it yourself. You should know what your blood pressure should be, and you should know what your glucose level should be every day when you stick your finger. You should know this, okay? You should know the levels. If you don't, Google it. Stop being so damn lazy. Move right along.
Or hypertensive disorders during pregnancy. Everything else, including type 2 diabetes and regular hypertension, is out. So legal experts have reviewed the evidence that UnitedHealthcare used to justify this, and the words they're using are strong. So they're calling it slipshod evidence, misstated medical guidelines, and one monitoring company even said, this isn't just cherry picking, it's medical malpractice. So this affects Medicare Advantage, Medicaid, and commercial plans under UnitedHealthcare.
Ooh.
Tens of thousands of people will lose monitoring that helps keep them out of the hospital. And because UnitedHealthcare,
like I said, y'all, you're going to have to do it yourself. Stop being lazy. I know it's convenient. It's convenient for me to have this on. It's convenient. But you can't be lazy or you're going to die.
Is the biggest insurer in the country, this could spread. So if this move is challenged, CMS could enforce penalties because Medicare Advantage plans are required to cover services that are medically necessary. And there is no federal guideline saying monitoring for diabetes and hypertension should be removed. So, the largest insurer in America is ignoring federal support for preventative care, cutting off chronic disease monitoring, and using questionable evidence to do it. Patients deserve to know that this isn't about safety, it's about cost cutting, and it puts real people at risk.
So they trying to cut some cost. They don't care about you, the people. They want to cut costs. I remember what happened to that CEO, UnitedHealthcare. What was that last year before last, something like that? Somebody unalived him. I don't agree with that part. I don't agree with that. Getting mad at people because, you don't like what they did when it's their company. Then you have to move on to someone else, another insurance company. Don't get mad and then try to unalive somebody, right? Y'all don't be doing that. Now, there's some crazy people out there now. You know what they thinking in their head. I dare them. I dare them to cut me off. I dare. Moving right along. There's going to always be nuts out there. Always. Crazy people. So get ready. All right, this one right here. This lady said they are removing millions of seniors on Medicare Advantage. Millions.
So we have more troubling news because of Trump's handling of the economy and the healthcare crisis.
She said because of Trump's handling of everything. It's always going to be Trump, y'all. Always, no matter what. Always. But this last lady, you're going to see. Let me let her speak her truth.
UnitedHealthcare just announced that they are removing 1 million senior citizens, 1 million from the UnitedHealthcare Medicare Advantage plan.
I thought it was a lie at first, y'all. But it's true. Okay. It's true. I Googled it. I did.
1 million. Why are they doing this? Because their profits are tanking. Why are their profits tanking? Because medical care costs are increasing. Why are they increasing?
Y'all let me know if your medical care has increased. Mine did. I'm on Medicare because I'm a senior. Okay, I worked and I paid in Social Security and I paid into Medicare taxes. Okay, just like a lot of you are doing right now. I paid into it. And mine went up. Okay, it was 180. Now it's, 202 or something like that. You may say, well, that's not a lot. Well, it's not a lot for me. Okay. But somebody else who don't have my income, oh, it's way too much for them. Way too much. Because they don't qualify for the Medicaid and the Medicare together. Because you can get both together. Some people, they don't take out of their Social Security check because they don't make a whole lot. All right. Moving right along.
Because of the upwards of $1 trillion in cuts to Medicaid and Medicare. And because there are so many more people now uninsured, they can't afford these premiums. And no, they're not illegals.
The people who are cut are not people on Medicare. It's the people's on Medicaid. Maybe they found out that something was wrong. They lied about something. They no longer get their food stamps. They no longer get Section 8 because they've been banned from the government because they found that they were telling lies and cheating. They found something wrong. So, yes, it's been cuts like that. And it's going to be other cuts, too, because, they want people to take their ass back to work. Go to work. Stop sitting on the system. Okay? Work and get some medical insurance on your job. We need you to work. We can't give everybody free medical care. We can't do that. We can't. All right? Do something with yourself. Do something with your life. What's wrong with trying to do something in your life to make it better so you don't be crying and whining all over the damn internet? What's wrong with that? Huh? Put it on down in the comment section. I know a lot of people ain't motivated. And I know some people just don't have a damn backbone. I already know that.
They're American citizens. But all of these people who are increasingly uninsured still go to the hospital, still need emergency care.
Right.
So that gets passed on in the form of higher medical costs
She's right.
to those that are insured.
Right.
Now, the 1 million senior citizens on the Medicare Advantage program is considered a low-hanging fruit for UnitedHealthcare because they're specifically targeting senior citizens on low income. They pay the lowest in premiums, but they utilize a lot of medical care, so the return on investment is getting poorer and poorer.
So they targeting, she says, the poor people on Medicare. Y'all ain't giving us enough money. You're not giving us enough. But see, what I don't understand is you pay Medicare tax on your paycheck. Y'all see it. Why the hell we got to still continue to pay Medicare? Even when we start getting our Social Security. And when you start getting SSI, disability. Some people pay it, some people don't. Like I said, it's according to your income. But why we got to pay that? You took that money. Where the hell is all that money? See, the problem is, let me tell you what the problem really is. A lot of these young people today, they don't work. They hustle. Some of them just don't work. Some of them live with their parents. Some men just live with women who's sitting on the system. They don't work. It's not enough young people to work to be putting into Social Security and into Medicare tax. It's just not enough people, okay? So maybe if you get some of the lazy ass people off their ass, maybe we will have enough money to take care of the elderly when they get sick. But y'all, do you think really they don't give a damn about the elderly? Y'all need to hurry up and pass away, okay? Too many of y'all get Medicare. Too many of y'all are going to the doctor, the hospital. Too many of y'all. Insurance companies are going dry. Y'all using us to death. Die, please, die. You think that's what they thinking? Put it on down there in the comment section.
This for-profit healthcare company. And those million senior citizens, a lot of them are located in red states. This affects you too.
So she's trying to say only conservative states, Republican states are the only ones doing it to their seniors. That's what they're saying. I don't believe that part. Nope. They're not just going to pick red states. They're not just going to do that. Okay, if it comes into effect, hell, it's going to affect every damn state. Okay, especially if it's passed. It's not just the red states. Don't believe that part right there. Now, some of the things she's saying is true. But she's nitpicking right now. She's nitpicking.
Trump voters, seniors who voted for Trump, this affects you too. What's most troubling is that economists are saying this. What UnitedHealthcare is doing is a leading indicator of what's next, what's going to be done by other for-profit insurance companies. And once they cut senior citizens off of these plans, you better believe it, they're going to go after other programs for insuring people who are not senior citizens. Great job, Trump.
I bet she hates Trump's guts. Like I said, though, I don't like everything Trump does. Okay? I don't like everything Biden did. I didn't like a whole lot of stuff that Biden did. And I didn't like some stuff that Obama did. But I don't hate none of these presidents. I don't have a hatred in my heart. Okay? Like some people, like this lady right here. She hates Trump. Trump deranged syndrome. I don't know if she hate him or not, but you can tell she really don't like him. She really don't, y'all. But she is telling the truth. It's not just going to stop there with UnitedHealthcare. It's not. So you might want to be checking your own insurance company to see what they got planned for you in 2026. You know, they send out them little booklets. They send out those little plans, you know, the Medicare Advantage. So you need to be looking at that. Don't be throwing that away. Don't be sitting it aside. You better be reading it and looking at it. And if you can't comprehend, get somebody who can comprehend for you. Moving right along. Listen to this lady right here. She's the last one. Pay close attention to what she's saying.
I'm not going to wear a hat today because I actually curled my hair. Now, everybody's upset because it's been in the news that UnitedHealthcare is going to basically send a letter to 600 of its Medicare Advantage members and saying, hey, find a new plan. We're not going to offer your plan for 2026. And they think, oh my God, the sky is falling. Something terrible has happened at UnitedHealthcare. No. Last year, which everybody already forgot, in 2024, 600 members from Aetna, they got the same letter.
Now, who was president in 2024? I am asking the Democrats. Who was president in 2024? This happened in Aetna, Humana, UnitedHealthcare. I guess they just catching up this year in 2025. Okay. Who was the president? Put it on down there. The lady before this video was blaming Trump. You see how that works? Do you see? I'm talking to the people on the left. We don't hate you, we love you. But y'all got to stop doing this now. Stop doing it. Do your damn research before you start blaming somebody, all right? Do it. We're sick of this mess.
And about 500,000 members from Humana got the same letter. So what you find in the Medicare Advantage industry is they all will eventually follow suit. So United's just doing it a little bit later. And what they're all doing is they're getting out of plans that are not profitable. It's for-profit business. So if they're not making money, they're going to leave that plan and they'll stay in plans and in counties that are still very profitable.
And y'all, that's what most companies do. If something is not working, you can't keep doing it. You got to change it to something else. You got to start cutting stuff. In this case, it's people being cut. Services, different services are being cut. Medications. Okay? That's what happens when you are in business. It's going to be some cuts. That's why I keep telling y'all, some of y'all really need a side hustle. Okay? Y'all see me doing side hustles. With something not working, I have to cut it and start doing something else and find out what works. Don't stay idle in the same damn thing, wasting all your damn money. Like these insurance companies, they stayed idle. They're like, enough is enough. Okay, we can't do this. So this started before Trump. All right? But they want to blame him for it. Now, can Trump fix it? Not by himself, he can't. It's got to be voted on. It's got to be. Y'all think the president can control everything. That is a lie. If it don't pass through Congress, if it don't pass through the Senate, then it's just dead, all right? And so you say to yourself, well, what the hell is the president there for if he cannot change things? Well, some things he can change, y'all. Like he can do executive orders. Close them damn borders, right? Yeah, executive orders on things. Certain things they can do. But important things that involve a whole bunch of people, the American people, you can't change it on his own. It needs a vote from Congress in the Senate. Okay. Then it goes to him and he says nay or yay. Hell yeah, hell no. Okay. So y'all need to learn and study and research your government. What they can and cannot do as a president. Look it up for yourself. Okay. Stop being stupid and dumb. And listen to some of these people on the internet, TikTok, YouTube, Instagram, Facebook. Stop doing that, y'all. Stop it. Put it on down there in the comments section. Are you going to be affected by some of these changes? Put it on down there. Let us know. Do you have a monitor like me? Do you have a blood pressure machine that can be monitored by your insurance company? Put it on down there. Will this affect you? You're just going to say, oh, hell, what the hell? Is it? Put it on down there and let us know. All right, y'all. With all that being said, make sure you like, share, comment, and subscribe. And watch the next video coming up. Thank you.
Yeah.